Hello everybody and welcome to the Hughes Clues. I call this dysrhythmia made easy, but that's a really untruth because dysrhythmia is not easy. It's a lot of different things that you're going to learn, but it's very important and you have to do it for this course. So what you're going to need to do this is a printed copy of the dysrhythmia worksheet. I'll have 3 or 4 recordings for dysrhythmias, just the basic learning, and that one copy will cover you for all of the different learning of the dysrhythmia. You're also going to need a blank sheet of paper, a fine point pen or pencil, and then a simple calculator if you want. You probably won't need it. All right, why do I have Hughes Clues disclaimer? Because if you were to listen to Dr. Reed's lengthy topic on, or lengthy recording on dysrhythmias, she's going to do it as it should be. I'm going to do the sloppy version. Why do I do it the sloppy way? Because you have a lot to learn for exam 2, and all you need to do is get through this course. So I'm going to give you the down and dirty shortcut. If you're somebody that wants to work in the dysrhythmia land, regardless of the area, whether it's a step-down unit or a critical care unit, then you're going to need to do a little bit more work once you graduate. This will help you get started, but you're going to need to do the finer details because there's rules that I'm going to give you that are going to work for this course, but those rules will not apply when you're in real dysrhythmia land. So again, this is the sloppy version, but you're going to learning my information, you're going to know what you need to do to get through this course because you're busy. All right, so let's go with the heart's function. We know that the heart's function is to beat. And because the heart is so important, the body realizes that we want that heart to beat on and on. In other words, there must be electrical activity first within the heart before there is actual pump activity of the heart. And any of the heart cells can depolarize or go to work and cause the whole heart to beat. That's how it works. And how the heart cells work, as far as how does one cell initiate the beat and then get everybody else to get on board and do the electrical stimuli, is very much like the wave that you see in football stadiums or any kind of sporting stadium. When one person or one cell initiates that raise the arm thing, then it really causes all the other cells to follow along. And that's how the heart works. Now, there are things, or there is a group of cells that are known as the primary pacemaker, or the SA node. And the SA node is really that leader of the heart cell land, because the SA node is the fastest. It's the one that can set a rate of anywhere between 60 or 100. And so if the SA node is the fastest, then the SA node is the first one that's going to initiate the electrical activity. And then, because that's how heart cells work, then the rest of the heart cells will follow with electrical activity. And if the SA node is asleep on the job, doesn't feel like working, or is diseased and ill, then the AV node will get in and do the job if that heart rate is not fast enough. In other words, if the SA node does its thing at 60 to 100 beats per minute, in other words, if the SA node is the primary pacemaker and usually sets the pace at 60 to 100, if for some reason the SA node doesn't work and there isn't a heartbeat in less than 60 seconds, and it's 60 in the minute, then the AV node will begin going. And so it can only set a pace. It can only set a pace between 40 and 60. Again, exceptions to every rule, none of which you have to know right now. But the SA node will set the pace at 60 to 100. If the SA node fails, the heart must beat on and on, then the AV node will get in on the job and do the work, and it can only go at 40 to 60 beats per minute. And then if the SA node fails, and then the AV node fails, the ventricles are down there going, yo, where's the electrical activity? And they're wait and wait and wait and wait. And when nothing comes down the electrical pathway, because the SA node and the AV node are diseased, then the Purkinje fibers will go, okay, fine, I'll go ahead and set the pace. And their pace is going to only be 15 to 40 beats per minute. And remember, the Purkinje fibers are in the ventricle, and the ventricle's the bottom part of the heart, which means that the electrical activity will start from the bottom and go up, which is kind of against the normal flow of electrical workings. All right, so let's talk about a couple of terms. What does it mean for heart cells to depolarize? That means there is a change in the electrical charge, and that means the heart cell is about to go to work. So depolarization, think work, whereas repolarization means that the electrical charge begins or returns to normal, and that's during the resting. So if you get these two confused, it's easy to remember that repolarization starts with an R. That's the heart cell resting. Depolarization is the heart cells ready to go to work. And again, as I discussed, the first heart cell will depolarize. They'll go to work. That will stimulate the next heart cell to depolarize in a wave of electrical activity. And you can see this wave through this kind of vignette that I have the reference point or the site referenced as I'm supposed to. But this just lets you know, here's the electrical activity, then it goes down to the AV node, which goes down to the Purkinje fibers. Now, what you have to know about this electrical wave is that whenever there is any electrical activity, we can see it. It can be recorded, and we record that on the EKG paper, and you're going to see a blip and a bump on the EKG paper, and that just indicates specific electrical activity of those heart cells, and we're going to talk about what each blip or bump on the EKG paper represents. So let's look at the EKG paper first. And what do you notice? Well, you see there's a whole bunch of itty-bitty little boxes. So here's 1, here's 2, here's 3, here's 4. So there's hundreds and hundreds or thousands of itty-bitty boxes on the EKG paper. And each one of those itty-bitty boxes represents time across the horizontal axis. Represents time. So each itty-bitty box represents 0.04. So what you should get from this is, you've got to memorize that it's 0.04 seconds for each itty-bitty box. And number 2 is that the heart really does, the electrical activity moves fast. Just like when you turn on your light switch, it comes on fast. So the electrical activity is very, very very fast is how it transmissions. And then, of course, you'll notice that there is a darker box that is outlined and that there's 5 by 5, so 25 itty-bitty little boxes in one big box. Notice that there are 5 itty-bitty boxes along the horizontal plane of time, and so that would represent 0.2 seconds. So again, fast, fast, fast. Now, do we measure anything on the vertical axis? Yes, we do. Nothing that you have to know in this course. It's milliamplitude. If you're the inquiring mind, don't have to remember that. You do have to remember itty-bitty box, 0.04, big box, 5 itty-bitty boxes, 0.20 seconds. All right, now we see on this EKG strip, there's a bunch of lips or a bunch of bumps on this paper, and each one represents a specific portion of the electrical activity, and they each have a name. And so on this, there are waves, P, Q, R, S, T. So let's label the waves, because this is what you're going to need to do when you look at an EKG strip. And so when we look at the EKG strip, I've just made it bigger so that you can see it. You can see that this first blip is a P wave. That is the P wave. What does the P wave represent? The P wave represents atrial depolarization. So you also have to note that the electrical activity will be seen on the paper, but the actual working of the atria doesn't occur till after. So just like in electrical activity, you have this electrical current, but the light doesn't turn on until the electrical current does its thing. So just know that there is a delay in going to work. So you'll see the blip first, and then it'll go to work sometimes a little bit after here. So when you see this P wave that is upright, see how it's upright, then we know that the beat has originated in the SA node, and that the first name of your rhythm will be sinus. So this is one of the first slippy, sloppy Hughes clues. If you see an upright P wave before these other complexes, then you know that that P wave, A, represents atrial working or depolarization, and that if the P wave is upright and before the QRS complex, then it is coming from the SA node. So it originated in the SA node. Then we look at QRS. QRS represents ventricular depolarization. That means the ventricle is getting ready to work. That's the electrical stimulus that's going to depolarize the ventricle and make it go to work. And then we have the T wave that you see here. The T wave is ventricular repolarizations or ventricular resting. So we have ventricular resting. Now let's look at some other things that you have to measure. And again, it's very difficult for me to kind of do this perfectly on the paper, but there are a couple of things that we measure that helps us determine the rhythm. And one of those is the PR interval, and it's always or frequently abbreviated PRI or PR interval. What is the PR interval? Well, it's the start of atrial depolarization, so it should start right here, and then it is ending when the atrial depolarization occurs. So you have this P wave and then this kind of a pause before the next Q. So here's a Q here, and that from that point to the beginning of here is known as the PR interval. Now, I always think, well, gosh, whoever created this, yeah, thanks to Heap, it would have been nice if you had just called it the PQ interval, because it's really from the beginning of the P wave to the beginning of the Q wave, but it's known as the PR interval. And then that has to be measured. So again, your eyeballs have got to really clue in to these itty bitty boxes. And so that is a measurement that we'll do. We'll also measure what's known as the QRS interval or the QRS. And so we look at the QRS from the start of the Q to the S, to where the S wave was. And there's the S wave there. Again, not as sharp of a line that I've drawn here, but you can see in general that this is pretty narrow and this is much wider, which means it's a longer span of time. Count the number of boxes in there. Now, this is very difficult for somebody like me who's a little bit on the aging side, and so it's very difficult sometimes to identify the PR interval. So this is where I say take your piece of paper. So this white box that I've created on the EKG is meant to represent a piece of paper. It can be a big piece of paper, and that's why you need that fine point pen or fine point pencil, because you're going to draw the line, or what I call a tick, down on that piece of paper, and then you're going to draw the tick where you think the Q wave is, and then you're going to take that paper up to another space and then measure how many blocks there are, how many itty-bitty boxes there are, and that's how you're going to configure that. Now, why do you even have to measure the PR interval in the first place? Well, what happens in the PR interval is it's basically a time span. In other words, it's a span of time where nothing else electrically is going on. It's allowing for that electrical current to go all the way across from the SA node, which lives in the right atrium, all the way down the right atrium, complete right atrium, and then across to the left atrium, because both the atria should contract or depolarize at the same time. So this allows the electrical impulse to go all the way through the atria, and it allows the atria to have time to not only depolarize but contract. They also contract. The atrial will contract. If you want to know about the cardiac cycle, email me, but it is during atrial contraction that a portion, about 25% of the atrial volume, it gets squeezed down into the ventricle, and then it will also allow the electrical impulse to be sent down to the ventricle, because remember, just like a wave in the stands of a stadium, it's going to take some time for that arm raising thing to get all the way through the entire stadium. And so this allows that to not only go down the right ventricle across the left atrium, but then to hit the AV node, which will then send it down to the ventricle. So it's kind of a relay station. So this time, that PR interval allows the relay of the electrical impulse. Again, notice that I made the tick earlier on my piece of paper. And then I move my paper up to this other area, and I look and I see that the PR interval in my world, in my measuring eye, is 1, 2, 3, 4, approximately 4 itty-bitty boxes. So that is 4 times 0.04 is 0.16. Now the PR interval has a range, a normal range, and that normal range, you got to know this, is 0.12 to 0.20, which means 0.12 for a PR interval means that there are 3 itty-bitty boxes, because 3 times 0.04 is 0.12, and then 5 itty-bitty boxes all the way across to one big box is going to be 0.20. Now, you might have measured it, if you were playing along with me, and you might have measured it to be a little bit less than 4 boxes, so maybe you would like to call it 14 instead of 16. Or maybe you think, well, I think it was 5 boxes. Potato, potato. It doesn't matter. As long as it's in the normal range, then you consider it's okay. Now, if you get something outside of a normal range, then reset your eyeballs, fine-tune that pencil or pen, and check it again, because you don't want to deem it as abnormal unless you check it twice. Now, if you're a real professional nurse, you'll get these things called calipers, which are even a really fine, sharper point. But for us beginners, a pencil is just fine. All right, so now we're going to measure the QRS. We're going to take our piece of paper. You could use a different color pencil, or you can use a different edge of the paper, but no matter. You're going to measure from the Q all the way to the S, and you're going to measure the QRS, and then I'm going to put this measurement, my tick mark, up here on the top, and I see that, to me, it is approximately 2 itty-bitty boxes, or even you could stretch it to 1.5 itty-bitty boxes. So that's either between 0.06 to 0.08. Either way, the QRS, again, for it to be normal, is what we say is greater, or excuse me, less than or equal to 0.12. Now let's talk about words, because there's a lot of times when I say to you the QRS is normal, it's the normal width, and that's equal to or less than 0.12. So when I say, or when I consider that the QRS is narrow, I say the QRS is narrow, and that means the same thing as it's less than or equal to 0.12. So you're going to see on some of the notes that it's a narrow complex QRS. That does not mean it's not normal. It means that it is normal. So narrow QRS means it's normal, that the QRS falls within that 0.12 or less range. So that's just a terminology, and I'm going to use that terminology throughout the dysrhythmia. So narrow QRS, this is a narrow QRS because the QRS is normal. The QRS width is normal. All right, now the next thing we want to do, or can do, is we want to count the rate. Now, I've got lots and lots of things to say. Count from R to R and divide by 1500. You know what? Don't do that, because a lot of students have emailed me in the past and they said, you know what? I get confused with this. So I don't want to confuse you. I don't want to give you more information than you know. Know that for Dr. Reed, whenever she gives you an EKG strip, it's a 6-second strip. And you know that 6 seconds divided into 60, because we always count our pulse for a minute, which is 60 seconds, that this is a 6-second strip, and that if we count the R waves, so there's an R, 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 if we count the R waves and then multiply by 10, that's going to be our rate. So I have 1, 2, 3, 4, 5, 6, 7, 8. So we can estimate, because it's not precise, it's an estimate, that this heart rate is somewhere close to 80. Could be slightly less, slightly more, but it is 80. So we know, great, this is normal rate, because anything between 60 and 100 is normal. If it's less than 60, it's bradycardic. If it's greater than 100, it's tachycardic, fast or slow. So that's how you calculate the rate. I do have the instructions here on if you want to be more precise on the rate. Ignore it unless you're an inquiring mind and have a whole lot of time. Now we talk about how do we look at the EKG. You've already identified how are the waves, what does each little blip or bump mean, or what do they indicate, and then we say, all right, now let's determine what is this rhythm that's in front of us. So I have a recipe that I use, or a path, to figuring out what EKG strips. And I use this recipe myself. This is how I go and how I determine what the rhythm is, because it helps and it's easier. That is not to say that one thing is more important than the other. I'll talk about that in a minute, but it is to say that this is the method that I use to always determine what the strip is. So what do I look at first? Well, I look at the P waves, all right? And I always start from the left-hand side. I always look at the first grouping or first complex of P, Q, R, S, T that is complete, because sometimes your 6-second strip that you get has a portion of it chopped off. Don't look at something that's chopped off, then go with the first complex that's completely there. And so I see a P, Q, R, S, T, so I know that this is my first complex that is present to me on the strip. And so the first thing I'm going to look at are the P waves. Are the P waves upright? So I look here, I see this one is, 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 this P wave's upright, this P wave's upright, this P wave's upright. That's the end of my strip. All right, so I say, yes, the P waves are upright, and they're constantly P wave before every QRS, and I see PQRS, PQRS, PQRS. So if you ask the first question, are the P waves upright? Yes. That means the impulse in our sloppy land originates in the SA node, and I can say categorically, without any concern or hesitation, that this is some kind of sinus rhythm, because when the P wave is present on the EKG and it's upright, then it's from the SA node. Then I look at the P wave, and is there a P for every QRS? And I see PQRS, 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 PQRS. Yes, there is a P wave for every QRS and a QRS for every P wave. That's very important. Now I'm going to measure the PR interval, then I'm going to measure the QRS, and then I'm going to calculate the rate. So when we look, we've already done this, but just to remind us, that when we looked at the PR interval, and there's the box right there, it's kind of light, but hopefully you can see it. So here's my box, and it's spanning. If I were to put it up here, because of course it's not spanning, but I can see one, oh my Lord, my eyes, 1, 2, 3, 4, 5 there, but I identify, oh, that's because I don't have it in the proper place. So it's really hard for me to get those X's in the right, or the box in the right place. But it's really 1, 2, 3, 4. So it's 4 boxes. So that's 4 times 0.04. So the PR interval is 0.16. It needed to be equal to or less than 0.2. So that's normal. And then I want to figure out the QRS. And I have a box over here. And the QRS is technically 2 itty-bitty boxes, so 2 times 0.04 is 0.08, so that's within the normal range. And then I've counted that there are 8 QRS complexes, and this is a 6-second strip. I take 8, multiply by 10, because 6 seconds times 10 is 60 seconds, and we know that we always count our pulse for a whole minute, so I know that this rate is 80 beats per minute, and then therefore I'm going to call this strip because everything's normal. P is before, we know it's a sinus rhythm. The PRI interval is normal, the QRS interval is normal, the rate falls within the normal heart rate, and so therefore I can say that this is normal sinus rhythm. If it didn't fall in the normal range, then I would say sinus rhythm, but this is normal sinus rhythm. It's very regular, P before every QRS, QRS for every P, the P waves are upright, the PRI interval is normal, and the QRS interval is normal. Now, we're going to use that method, that EKG recipe, for every strip that we're going to look at for the rest of this presentation. So here's another strip. So I have all of the normal method right here for you. And so you try and figure it out on your own. So pause the recording, do your measurements, figure it out on your own. If you have any questions, email me. I'm going to keep going with this recording so there's not a bunch of blank space on the recording. All right, so when we look at our recipe, the first thing we want to know is, are the P waves upright? Well, here's our P wave, and they are, each one of them, upright. So therefore we know when the P waves are upright, our first name of this rhythm is going to be sinus. So that's part one of this rhythm identification. Now we're going to look at the P waves again, but is there a P for every QRS and a QRS for every P? So I see P, QRST, P, QRST, P, QRST. So the answer to P wave for every QRS and a QRS for every P is yes. Then I'm going to measure the PR interval. Again, I'm going to start around here and end around here. And by my eyeball sight, I think it's 5 itty-bitty boxes. 5 times 0.04 is 0.20. 0.20 and less is a normal PR interval. So far, we have a normal PR interval. Then I'm going to look at the QRS, and we see that the QRS complex, which would begin here and end here, is going to be normal. It's going to be normal because it's about 2 boxes. And so this is, and it really ends here. I'm sorry, I should had say that the S is the line that gets all the way to this point. So this is from here, from the first dip to the end. So from here to here is about 2 full itty-bitty boxes, so that's 0.8. Now I'm going to calculate the rate, and I see 1, 2, 3. Well, it's not really rocket science to figure out that this is a pretty slow rhythm, and sure enough, it is. The rate is 30. That is definitely less than 60. Now, I've got on here normal sinus bradycardia, and you could say that it is normal sinus bradycardia, but it would be also safe or accurate to say that this is a sinus bradycardia. Normal sinus bradycardia or sinus bradycardia really is a good name for that rhythm. Now we've got another rhythm here. So again, pause the recording, look at the rhythm, and try and identify what this rhythm is using the recipe that's in front of you. Now I'm going to just do a caveat here that this is not a 6-second strip. So your number is going to come up a little bit differently than mine, but we'll get into that in a minute. All right, so here we go. We have our P waves, and we're going to look at them and see if they're upright. Well, this one is our first full complex, and I see a pretty P, QRST, then a P, QRST, P, QRST, P, QRST. And when I look at these P's here, 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 I say, all right, all of those P waves are upright. So because I'm saying that, yes, the first name of the rhythm is sinus because all of the P waves are upright. What do I look at next? Well, I look at the P waves, and is there a P wave for every QRS or a QRS for every P wave? So P, QRS, P, QRS, P, PQRS, 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 PQRS. All right, I see that there is a P for every QRS, a P wave for every QRS, and a QRS for every P wave. Now I'm going to measure the PR interval. And I calculate my PR interval from here to here, and I think it's 4 boxes. 4 times 0.04 is 16. So my PR interval is 0.16. That's normal. Then I'm going to measure the QRS, and the QRS is pretty dang narrow, and I think it straddles one full itty-bitty box and then half an itty-bitty box. So I have it at 0.06. I've had students in the past tell me, well, I think it's 2 full boxes, 2 full itty-bitty boxes. Could be that's true. 0.06, 0.08, potato, potato, it's still normal. So our QRS is normal, or it's a narrow complex. Now we're going to calculate the rate. And if you count all these, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 16. A lot of students would say, well, that looks like that's 160 beats per minute. No, I calculated it the more accurate way because it is not a 6-second strip. I'm sorry, I should have just chopped it down and made it a 6-second strip because it's really 6 second goes from this tick here to this tick here. So there's a lot of complexes that are off. So this is about 125 beats per minute. Again, don't sweat it. Please don't sweat it. The only reason why I mention it on this recording is because students will email me, and I just want to save you some time. But the heart rate is about 125. You could probably say 130. It's fast, so there's no denying that this is a fast rhythm. But because we have a PQRS and a T for every single complex, this is still a sinus tachycardia. So we can call this sinus tachycardia, normal sinus tachycardia. Both names are correct. Email me if you have questions. All right, now let's look at this rhythm. Again, try and figure it out. Pause the recording. When we look at this, we see that the first question that we are supposed to determine is, are the P waves upright? Well, I look at this rhythm and I see a bunch of squigglies. A bunch of squiggly, squiggly, squiggly lines. What's a P? I don't know. I see this. Is this a P? Is that a P? Is that a P? And if you say to yourself, I don't know, then you don't know that there's a P. And if you look at the 3 previous strips that I gave you that were sinus rhythms, which very easily identifiable P waves, you can look at this and go, you're right. I can't really see an easily identifiable P wave. Now, it can be, in real world, a little bit difficult to determine whether there's a P or not, but I can promise you on Dr. Reed's tests, the strips are crystal clear. If there's a P wave, you're going to see it. It's going to hit you in the head almost. Because Dr. Reed gets her strips from the same place I get my strips. We call those Google images. So it's going to be easily to identify. It's not going to be tricky. The strips on exam 2 are not tricky, and the final are not tricky. They're picture perfect. So when we look at this, it is very easy to identify that it's just a wavy baseline. It's a bunch of jigglies, and there is not an easily identifiable P wave. So therefore, I can't say anything about the P wave, and therefore I can't answer the second question or the third question. I don't have a P wave to figure it out. So then the next thing I want to do is I want to look at the QRS. Now, this QRS, you can see here, and on every QRS, if you wanted to really take the time to measure every single one, you can see that this QRS is what I call normal. In other words, the QRS is less than or equal to 0.12. And when you have a strip that is clearly not sinus, it's not sinus because we can't see anything to do with a P. We can't see an upright P. We don't see anything to do with a P. We cannot call this sinus, but we see that this is a narrow, complex rhythm. And so whenever the QRS is normal width, whenever it's narrow, then the first name of the rhythm is atria. Now, what does that mean? What that means is that the SA node, for whatever reason, fell asleep on the job. The SA node decided, I'm not going to send the beat or originate or pace the electrical activity. And some atrial cell said, well, I want to do it. And so any rogue atrial cell can say, I want to set the pace. And unfortunately, when rogue cells set the pace, they don't set a good pace, not usually. And so therefore, this rhythm is paced by some rogue atrial cell. Now remember, if we go back, because the heart must beat on and on, I did mention that any heart cell can set the pace. Any heart cell can initiate the electrical activity because that's their ability. That's how heart cells are made. Usually it's done by the pacemaker, that's the boss, but if the boss falls down or if some rogue cell wants to do a coup and be the one in command, then they can. And once they set the pace, then all the other little heart cells will follow in a wave. Now when we talk about the wave or the rate, you can still identify it very easily. It's the same thing. This is a 6-second strip. There's 1, 2, 3, 4, 5, 6. Oops. 1, 2, 3, 4, 5, 6, 7, 8, 9. There's 9 QRS complex. This patient has a heart rate of 90. 9 times 10 is 90. Now, what's the rhythm? Well, there is no way for me to tell you to figure it out other than to simply memorize it. And this, we know, I told you the first name of the rhythm is atrial, and the last name of this rhythm is fibrillation. It is simply a memorization. Now, you might think or consider that what is the heart doing or what is the atrial doing, because this is atrial fibrillation. Well, the atria are quivering like jello. And if you want to just shake your body, and that would make sense that that's what it looks like when it's on an EKG strip. So this is atrial fibrillation. The atria do not have a organized mechanical or, an organized rhythm, and therefore they are not organized in their pump fashion, and so they're just quivering like a bowl of jello. And that's the atria. The atria are quivering like a bowl of jello. The ventricles are beating and pumping and depolarizing just fine. Now let's look at this rhythm. Slightly different than the one before, but definitely not the same as what we've already looked at. So you can pause the recording and try and figure out this one. What is this? So, P waves, are they upright? Well, again, I'm not sure which is the P wave. I see 3 waves here, and they look like ocean waves to me, because I'm an ocean person, or shark's teeth, however you want to call them. I see 3. Which one's the P? Which one's the T? I don't know. And so therefore, I cannot easily identify a P wave, so I say there's no P waves. I can't count the P waves. I can't answer question 2. I can't answer question 3. Now, when I do measure the QRS complex, because there's a beautiful QRS complex there, which represents ventricular activity, I see that it is darn narrow. Some of you might say this looks like 0.06. Some of you might say it's 0.04, and some of you might say it's 0.8. No matter, it's less than 0.12. So the QRS is definitely narrow. And by narrow, I mean the QRS is normal. And this QRS, when it is normal, when it is narrow, the first name of my rhythm is atrial. So this is some kind of atrial rhythm. It's definitely not a sinus rhythm. This did not originate in the sinus or in the SA node. It's originating somewhere in the atrium. And when we count the QRS complexes, we see 1, 2, 3, 4, 5, 6, 7. So we see that our rate is 70. And again, this is the sheer memorization. When you see what looks like shark's teeth or ocean waves, this is called atrial flutter. Atrial flutter. Next rhythm. And the last of our atrial rhythms. All right, we see, our first question on our rhythm or on our recipe is, let's look at the P waves. Well, again, when I look at the P waves, I just see this one big glob in the middle. I don't know if that's a T or a P. I don't know what it is. So I just see the hump in between all of the QRS complexes. So if I'm not sure that this is a P wave, then I have to say that it's not, and that therefore I cannot answer question 1. I cannot identify if there's a P for every QRS and a QRS for every P, and I cannot measure a PR interval. So then the next thing I can do is I can look at the QRS, and I see that it's narrow. It is normal. It's somewhere between, I put it 0.08, but you might think of it as 0.06. Either way, it's definitely less than 0.12, and I say that this is a narrow QRS complex. Whenever the QRS is narrow, then the first name of our rhythm is atrial. So what's the second name? Well, let's first calculate the rate, and we see, I'm not going to count through because then your brain would go, stop already, but pause the recording and count, you can see that there's 24 QRS complexes. And if you multiply that by 10, that's a rate of 240. That's fast. Put the two together. If the first name of the rhythm is atrial and the second name is tachycardia, put the two together and you have atrial tachycardia. Now, atrial tachycardia is not usually the most common name that you see this rhythm described as. Most of the time you will see this rhythm described as supraventricular tachycardia, which kind of confuses people because they see the term ventricular and they think, this is ventricular tachycardia? No, this is not ventricular tachycardia. This is supraventricular. And when you think about, if you break it down in our English language and you think of supra, supra means above, ventricular, so above the ventricles. What's above the ventricles? Well, it's the atrium. And so that's why supraventricular tachycardia is another way of saying atrial tachycardia, because you can never have too many names for the same thing. And then we look at another name that you might see it listed as sometimes in the literature, and that's PSVT. So PSVT stands for paroxysmal supraventricular tachycardia. And what that means, that you'll never see it on the exam, is that you would see on this strip, you would see a run or a portion of it as sinus rhythm or sinus tachycardia. And then you would see this rhythm smack dab in the middle, and then you would see maybe some sinus rhythm towards the end of it. So in other words, patients can kind of go in and out of more than one rhythm. You are not going to get that on a critical care test, but you will see it in real land hospital patients. So just to make sure that you are familiar with many of the terms. So this is atrial tachycardia or supraventricular tachycardia. I hope this recording has been helpful. Again, take a little bit of time to digest the information. This is not easy stuff. And then email me if you have any questions.